Hello everyone, a warm welcome to all of you in the today's daily current affairs session on EduTap, and I really believe that all of you are healthy and preparing well for upcoming SEBI Grade A prelims exam. And when we talk about these exams, we all know that current affairs plays a very important part, and PIB is one of the most important source of these current affairs, and that is the reason that today I am discussing a very important topic from the month of February 2022, that is Ayushman Bharat Digital Mission. So before starting the session, if you are new to your YouTube channel, kindly subscribe it and press the bell icon to receive all the latest updates of the courses and videos offered by us. And you can also join our Telegram channel to get the access to the PDF of the sessions. To join the Telegram channel, kindly click on the link given in the description below. So let's move on to the session. Let's get started. So here you can see the topic of the today's discussion, the Ayushman Bharat Digital Mission. But before that, let's see that why exactly it was in the current affairs. Okay, why it was in the news. So basically here you can see that the Ayushman Bharat health account numbers have been integrated with the Arogya Setu app, that you must be aware about it. And after the announcement of the Ayushman Bharat Digital Mission, it is basically currently generated 16.4 crore such ABA numbers, and it is basically expected that it is going to amplify these numbers further. Okay, so before discussing about the ABA numbers, let's first discuss that what exactly this Ayushman Bharat Digital Mission is all about, which as per the Prime Minister Shri Narendra Modi is going to revolutionize the digital health infrastructure ecosystem in our country. So when we talk about the Ayushman Bharat Digital Mission, so basically this was launched by Honorable Prime Minister Shri Narendra Modi on 27th of September 2021. And why exactly this particular mission was being launched? The reason behind that was to make the backbone of the digital health infrastructure in our country more stronger, and that was the reason that this particular mission was being launched. So when we talk about the aim of this particular mission, basically it aims to create a national digital health ecosystem which is going to support the universal health coverage across the country, and this will be done by making the health facilities efficient, accessible, inclusive, affordable, timely, as well as safe for all the people across the country. And apart from that, this particular mission is also going to ensure the security, confidentiality, as well as the privacy of health related personal information. So I really believe that this part is very much clear to all of you. Now when we talk about the Ayushman Bharat Digital Health Infrastructure Mission, here you can see that this mission is going to bridge the existing gap which is presently existing between the different stakeholders of the healthcare ecosystem, and this will be done with the help of digital highways. Now who these different stakeholders are exactly? See, these includes the policy makers, the providers, the allied private entities, healthcare professionals, non-profit organizations, the administrators. So between all these different stakeholders which exist in our country, the gap which is existing will be reduced, and that's how it will impact the affordability as well as availability of the health infrastructure as well as health facilities to the people of our nation. So now when we talk about the different objectives of this particular mission, this mission will establish state-of-the-art digital health systems across the country. It will enforce the adoption of open standards. It will create a system of personal health records, which we will be discussing while discussing the ABHA numbers. And now when we talk about some other important objectives, it also aims the promotion in the development of enterprise class health application ecosystem, as well as it will also help in adopting the best principles of the cooperative federalism. So that was all about this particular mission. Now when we talk about the different key features of this particular mission, here you can see that it is going to connect the digital health solutions of the hospitals across the country with each other, and that's how we are going to just reduce the existing gap, to bridge the gap between the different stakeholders which is existing in the country. Okay, so apart from that, it is going to create a seamless online platform which will enable the interoperability within the digital health ecosystem. It will also help in making the health records as well as health IDs of the people, and it is going to enable a host of other facilities as well, such as the digital consultation, the consent of the patients in letting medical practitioners access their records, etc. So these were basically the key features of this particular mission. And now let's move on to the ABHA numbers, that why exactly the Ayushman Bharat Digital Mission was in the news, as well as what exactly these ABHA numbers stands for. So basically I want to tell you that this Ayushman Bharat Digital Mission, see, it is a flagship scheme of the National Health Authority, okay, under the Ministry of Health and Family Welfare. So when we talk about the current affair, that why exactly it was in the news, so basically this particular part, that is the ABHA number, has been integrated with the Arogya Setu app. Okay, so basically this integration is going to take the benefit of these 14-digit unique ABHA number, that stands for Ayushman Bharat Health Account numbers, to the Arogya Setu user base and beyond. Okay, and apart from that, when we talk about these ABHA numbers, with the help of this ABHA number, a person can access and share his or health record digitally. So basically we are digitizing the health records, as well as it is going to enable the government to make them digital, and the record keeping will also become more efficient with the help of this particular part. Okay, now when we talk about these ABHA numbers, see, this ABHA number enables the person for his interaction with participating healthcare providers, and it also allows him or her to receive the digital lab reports, prescriptions, as well as the diagnosis seamlessly from a verified healthcare professionals as well as health service providers. Now there is some other important information about the ABHA numbers which have been mentioned here. That is why exactly this ABHA number is more impactful. See, using the ABHA, it is a first step towards creating the safer and efficient digital health record for the person as well as his or her family. And you can adopt this into create a digital secure ABHA which allows you to access and share your health data, which we have already discussed. So basically when we talk about this ABHA, see, it is really going to help in keeping the digital health records. It is very easy to sign up this particular part, and a person can voluntarily opt in and opt out from these ABHA numbers as well. So now let's move on to the very first practice question from this particular topic, and let's see that what exactly we have from this. So basically in this particular question, what you are required to do, what is the demand of the question? It is to identify the incorrect statement in relation with the Ayushman Bharat Digital Mission, and in this question you are just required to identify the incorrect statement as per our discussion in the today's session. So the very first statement says that it is a flagship initiative of the National Health Security under the Ministry of Health and Family Welfare, which is absolutely correct. The second statement says it was launched on 27th of September 2021, which is once again absolutely correct. The third statement says that it is going to connect the digital health solutions of the hospitals across the country with each other, which is once again correct. So what exactly will be the right answer? The right answer is option E, that is none of the above. And why so? Because in the question the demand was to identify the incorrect statement, but as we have seen that all these statements are correct in relation with the Ayushman Bharat Digital Mission, so that is the reason that the right answer will be none of the above. Okay, now moving on to the next question. The next question is, the Ministry of Culture, Government of India is organizing first of its kind global summit on reimagining museums in India. So basically you are required to tell me in the comment section below that in which of the following places this particular global summit will be conducted, whether it's Hyderabad, Kolkata, Bangalore, Jaipur or Shimla. So basically this particular summit will be organized as a part of Azadi Ka Amrit Mahotsav, and when we talk about the place where this will be conducted, so this is basically option A, Hyderabad, where this particular global summit on reimagining museums in India will be conducted. So here you can see from the headline of the PIB itself that Shri G. Kishan Reddy to inaugurate the first ever global summit on reimagining museums in India in Hyderabad. Okay, so basically this particular summit will be organized by the Ministry of Culture. The participation, the people which will be participating in this particular summit will be people from different parts of the countries like India, Australia, France, Italy, Singapore, United Arab Emirates, United Kingdom, who is going to take part in this particular summit. And apart from that, when we talk about this summit is going to bring together various people who are basically the experts and practitioners in the field of museum development and management. And that is the reason that this particular summit will be conducted in Hyderabad, and the summit is on reimagining museums in India. So I hope that this is very much clear. Now apart from that, there is also one more information that this online summit will encompass 4 broad themes, and these includes architecture and functional needs, management, collections and conservation practices, education and audience engagement. So these were the 4 themes which this particular summit is going to encompass. And now let's move on to the Gooey question from the today's session. So today the Gooey question is basically based on the global analysis of healthcare waste in the context of COVID-19, and this report is really very important because this report was being released by the World Health Organization, and all such reports which are being released by such important international organizations are really very important from the exam point of view. So what you are required to do in this particular question, you are basically required to identify the incorrect statement in relation with this particular report. So kindly go through these particular statements and tell me that what exactly is the right answer in the comment section below. So now when we talk about the homework question from the previous session, in the last session I just asked the question that with which one of the following countries India has recently signed an MOU in the field of tourism to enhance cooperation and encourage expansion of the bilateral relations in tourism, and the right answer was option B, that is Australia. And these are the people who have answered the question correctly in the comment section, and that is the reason that these are the star performers from the previous session, which include Shivoham Gupta, Mukesh, Vishal Srivastav, Mansi, Yukti, as well as Shivani Singh. Now if you also want your name to be mentioned here in the upcoming session, then please give me the answer in the comment section below to this particular question. So basically you are required to tell me that this through Apada, the rise of USD 9 billion in 2001 to dash in year 2021, and what exactly this data is related to. This is related to the exports of agricultural and processed food products through ABDM, which stands for Agriculture Products Export Development Authority. So do give the answer in the comment section below. And guys, that was all from the today's session. I really believe that today's session was useful and fruitful to all of you, and if you are having any queries, you can drop us a mail at hello@edutap.co.in, and you can also call us at 814-620-7241. So thank you for joining us. Wish you all happy learning.